everybody. Hello, and welcome to the webinar. Welcome, everyone. Welcome. Are you ready for the cardiovascular system? Today, we are going to go straight in, nail this GPhC exam. There's 165 of us on here tonight, and it's going up. Let me take this opportunity just to welcome all of you. Feel the best place to be tonight. We've got the one and only Udocha Pascal in the house. Great to have you on. We have the lovely Lisa is back again with us tonight to help us, to support you. Lisa has been there, done that, and helped so many trainees succeed in this exam. And Lisa is here with us tonight. We've got Amara Angel. How do I join us? If you are on Pre-Read Shortcuts, then you'll be part of the group. If you're not part of Pre-Read Shortcuts, then you cannot join the Telegram group. But you can benefit a lot from these free webinars if you're not part of Pre-Read Shortcuts. So it's all good. We always have something for everyone, whether you're on the course or not. We're still going to help you. Give me one. Alim Javid, if you're ready for a great time tonight, type of one. Give me one. Yes, ladies and gents, it's going to be a great session. Again, it's all about helping you, showing you exactly what to focus on, those areas that will get tested in the GPhC exam. We're going to look at the cardiovascular system. Why are we focusing on the cardiovascular system? Why? Because you get loads of questions in your exam from the cardiovascular system. How many of you agree? If you agree that we do get loads of questions from the cardiovascular system in the exam, please type a yes in the chat. Give your boy Marvin a yes, because I'm buzzing tonight. It is hot outside. It is hot in here. I'm feeling hot today. I'm bringing the heat. I'm going to help you guys pass, because that's what I do. I help trainees pass the exam. That's what I do. I've been doing this for 10 years. I've not changed. Same energy, same passion, helping so many trainee pharmacists succeed. And I am so glad, so delighted that I'll be helping you today. I've taken so much time, by the way, to put these slides together for you, just so that you have something to help you pass. It is a free webinar, but if you look at my free webinars, I do so many. The amount of value and the amount of good content that you get from these free webinars is amazing. You don't get this much value in a free webinar. But I'm very happy today to give this to you guys, do this for free for you guys, because my main aim is for you to succeed. Marvin, you haven't seen the heat from Malaysia. Oh, I can imagine. What's Malaysia, like 50 degrees, is it? Man's not hot. Man's not hot. Jerry, man's not hot in Malaysia right there. I can see Jerry in Malaysia right now with a heavy jacket in the heat, 50 degrees. Jerry is in the sauna. Great, guys. Are we ready for tonight? We're going to try to do this stuff in an hour. As you can imagine, those of you on the Pre-Read Shortcuts course, we have the cardiovascular system on its own. I do the whole cardiovascular system. And if you look at the videos, just the cardiovascular system is 12.5 hours. That's how much time I spend covering the whole chapter in detail for you. Pre-Read Shortcuts, cardiovascular system is 12 hours. So I have the challenge now to condense 12.5 hours into 1 hour. So that's what I'm doing for you, ladies and gentlemen, today. I'm literally condensing a 12.5 hour lesson on the Pre-Read Shortcuts course into 1 hour. Content specific, the key areas that get tested in your GPhC exam. No time wasting, no nonsense, straight to the point. Let's do this, guys. Who is ready tonight? Who is ready to smash this tonight? Type of boom. Type of boom, type of boom. Give me a boom, ladies and gents. Let's do this. Let's do this. Let's turn our dreams into reality. Pharmacists, here we go. Here we go, pharmacists. In a few months, you all will be pharmacists. I guarantee you will pass. You will pass. So here we go. Here's what we're going to do today. We're going to look at feedback from the November and June exam 2024. You cannot go into this exam without looking at the feedback from the last exam from the GPhC. But Marvin, why do we have to look at the feedback from the previous exam? Because the GPhC puts that there so that you know what areas get tested so that you know what areas the students struggled with the most. And even more important, the GPhC tends to ask you questions on the same areas in different exams. So there's a very high chance that what they've written, the areas that students struggled with last year in June, in November, they will potentially ask you similar questions this year. This is the reason why people say to me, Howard, how can you predict what the GPhC is going to do? It's just a prediction. Calm down. Calm down. It's just a prediction. But the reason why I can predict is because the GPhC gives you clues, right? Success leaves clues. There are clues in this stuff, guys. There are clues in your GPhC framework, literally guiding you on where those questions will come from, literally guiding you on what to focus on, showing you the path to success, guys. You have to see that it is there for you. But if you cannot see it, don't worry. I'm going to help you see it now. Today, you're going to see what I'm talking about. You are in the best place at the best time with the best, guys, with the best in the house, in the business. So we're going to look at the feedback from last year. How many of you want to see the feedback from last exam, the June and the November exam? Please type on me. Please type on me in the chat. Please type on me if you really do want to see what the feedback was from the GPhC. Then, how to revise before your GPhC exam. Unfortunately, we only have a few days left. Those of you on the Period Shortcuts course, those of you on my private course, those of you that do one-to-ones with me, we've been doing this throughout the whole year, so you have a lot. You are ready to smash it. Believe in yourself. But those of you that haven't worked with me and you're here for the first time, you're asking yourself, oh my God, do I have enough time to learn all of this stuff? No, you don't. I'm joking. Time is short, but there are some important things that you need to do now to help you pass. So how to revise before the GPhC exam, I'm going to show you the just 3 key things you need to focus on. It's a bit short now to implement all of them because I've been implementing this stuff throughout the whole year with my trainees, but I'll still give you the formula. So what to focus on specifically when revising? Okay, what to focus on? That's what we're looking at today with the cardiovascular system. I want to make sure that on the day of the exam, a few days from now, on Tuesday, 24th of June, this is the most important day of your life. There is no other day as important as the 24th of June because this is a life-changing day for you. This is the day where you turn all your dreams into reality. This is the day where all those 4 years at university where you've had sleepless nights, you've been struggling with exams, long exams, suffering, no money, broke student, tough part-time jobs, issues, family issues, challenges, all those challenges, everything you've gone through all comes down to this one day, 24th of June, 2025. And my goal for you is to make this day very memorable. One of the best days of your life. Okay, that's what we want to do. So we're going to look at what to focus on specifically when it comes to cardiovascular system. We're going to look at those common areas that get tested on this chapter. And every year I predict this stuff, guys. You can watch, you can speak to pharmacists. There are many pharmacists that were trainees last year. They've been to my sessions and they will tell you. They'll tell you, hey, you know what? You need to listen to this guy. This weird guy with a weird accent, big white teeth, always smiling, so much energy. You need to listen to this guy because this guy's predictions do come. So I'm very confident with what I'm about to show you today. Calculations practice, we're not going to do that today. There's going to be no prize draw. So forget the last 2 points. I had that previously. Take that off. Today is all about the top 4. Are we ready? Type of 4. Ladies and gents, you're ready for tonight? Type of 4 because I'm gassed. I'm buzzing. Let's go. Are we ready? Type of 4. Type of 4. Type of 4. 3 steps to pass the GPhC exam. 3 steps. 3 easy steps to pass the GPhC exam. If you guys had followed me from the start and you joined me from the start, you would have gone through these 3 steps. Unfortunately, we cannot really do them now. You don't have enough days to literally smash these, but you guys have been doing it. It's nothing new. You've been doing this. So there are 3 steps. Step number 1, understand, learn, master the GPhC framework. The first step is understanding the GPhC framework. But Marvin, why do we need to understand the GPhC framework? Why is it so important? You're going to see why. This is the most important thing because there we go again. The GPhC framework, every single question in your exam will be from the GPhC framework. Every single question, 120 questions in clinical, 40 questions and calculations. Every single question you're going to get will be from the GPhC framework. Do you see why this is important? Because you need to know, if you master that framework, you understand that framework, not only is it going to guide your revision, it's going to help you focus on the right things, it's going to make you know what are the key areas that get tested. It's also going to help you to know what to focus on just a few days before the exam. Number 2, make notes. You need good notes. You need good notes. Anyone that knows me, everyone says period shortcuts, the clinical notes are one of the best. Not only because I helped making these notes, but the reason is because the way we made the notes on period shortcuts is we consulted trainees. We found out what were the challenges, what they wanted a few years ago. So these trainees actually helped us in a way make the notes for you. And this was about 9 years ago, okay, in terms of the style. We always update the notes, but this was the form, the way we make notes, the detail, the quality, the mnemonics, the colors, everything, the questions, everything was guided by trainees like you, how to learn best, okay? And then finally, questions, practice, questions, practice questions. What is the secret to success? Questions. If you're struggling, questions. Before the exam, what do you do? Questions. Past papers, mock papers, questions. In fact, there is a golden number. There's a golden number of the number of questions that you need to do before the exam in order to massively increase your chances of passing. There is a specific number. If you want me to tell you the number right now, type me. There is a specific number. I call it the sweet spot. If you, Jerry, man like Jerry has been watching my videos. You know man like Jerry has been on the track with me for a while right now. Man like Jerry has put it down there. Jerry knows the stuff. Guys, this is how specific we are when it comes to this exam. We don't mess about. I don't mess about with the GPhC exam, guys. Like literally, Jerry's put it down there. 666 questions. If you want to get the sweet spot of 1,200 questions, and that's including MEP, OTC, calculations, clinical. If you do 1,200 good quality GPhC style questions, 1,200 before your exam, you increase your chances of passing this exam by up to about 20-30% on top of what you're already doing. The golden number is 1,200, but if you get 660, it's fine. But if you want to guarantee yourself a good spot, confidence, walk into that exam feeling like the boss, feeling like the king, feeling like bring it on, 1,200 questions, 1,200. That is the sweet spot. And it's easy to do. It is easy to do because if you think about it, how many mock papers have you guys done? Now, if you do good mock papers, just clinical on its own, you have 120 questions. So if you did 10 good quality mock papers, just clinical already takes you to 1,200. If you did 10 good quality mock papers, guys, I'm telling you, we have all the secret sauce here. Who wants the secret sauce? We've got the secret sauce for you. I love this stuff. So 3 things: GPhC framework, your notes, practice questions. When I work with trainees, which I've been doing for the last 10 years, most of the reasons when a trainee fails the exam and comes to me to help them to pass the next time, because so many of them come to me, I go, oh my God, Marvin, I wish I joined you earlier. Oh my God, Marvin, it's 3 days before the exam. Even 1 or 2 days before the exam, I've got trainees joining me to do motivational sessions with them one-to-one. They're like, Marvin, please, can we just have a one-to-one session? I just need to be motivated. I need you to give me that energy. I need to be positive. I've done the reading, but I still doubt myself. I want to walk into this exam with no doubts, with total confidence, and I want to smash it. So these guys book like sessions with me 1 or 2 days or 3 days or 4 days before the exam for like an hour. And literally we go through steps and then they walk into that exam and they totally nail it. But most of the time when trainees fail or when they struggle or they don't pass the exam, I normally find out that the 3 main areas. Either they've not really understood or gone through that GPhC framework properly or focus on the right thing. They don't really know what to focus on. Or number two, they don't really have the best notes that are easy, that are fun, that are engaging, that makes life easy for them. Or number three, they've just not practiced enough past questions or no access to good quality questions. That's most of the time where the challenge lies. But if you can combine all three and tick these boxes off, man, I promise you're smashing this exam. You are going to pass. There's no question about it. You unlock that formula. So why is reading the GPhC framework the most important? Exactly what I said. This is your first step, okay? It might not be enough time now to start reading the whole GPhC framework, but I'm going to tell you what you need to know right now. The first thing you need to know is that all the questions, guys, all the questions, not one question, not two, not three, not 30, not 50, not 60, not 70, every single question, all the questions in the registration assessment are derived from the assessment framework. All of them, all of them, all of them. So if you really want to smash this exam, you need to know this assessment framework because all your questions are going to come from there. Now, let's look at what happened in June 2024. So this time last year, your colleagues for this exam, they're in the same place like you, the same situation. What happened? So 67% of the questions in the exam in June last year were from your high-rated areas. How are you going to know your high-rated areas all in the GPhC framework? 67% of the questions were from there. 25% were from medium-weighted outcomes, and only 8% was from low-weighted outcomes. Okay? This was June 2024. November, just a few months ago, 69% of questions were from the high-weighted areas, 25% medium weighting, and 6% low-weighted outcomes. So what I've noticed of all my years of experience working with you guys, trainees, helping them succeed, I've noticed that the GPhC tends to, from the high-rated areas, you normally get 67% and above. 67% plus high-rated areas. Your medium weighted tends to be around 25% most of the time, especially getting more and more questions from your respiratory chapter, but tends to be 25% medium. And then low weighted chapters, 6%, 8%, it could be up to 10%, but low weighted is really low weighted. So the reason why I'm showing you this is because the GPhC doesn't lie. When they say to you, 67% of those questions you're going to find in your exam will be from the high rated areas, they are serious about this stuff. What does this mean to you? What does this mean? How can you translate this stuff? What this means is you need to be spending 67 to 70% in the next few days on your high-rated areas. So let's break this down in days, right? How many days do you have left for the exam, guys? How many days before your exam? Type in the chat. How many days do we have before the exam? How many days do we have? Your exam is on Tuesday, 24th of June, right? So let's say we've got 5 days, right? We're not going to say 6 because you're going to write the exam. Wow, 300 of us on here. What a turnout. So let's say we've got 5 days. We've got 5 days to the exam. What does this mean? This means for the next 2.5, in fact, 3 days, out of the 5 days, 3 days, 3 of those days. So today's Wednesday. We're looking at Thursday, Friday, Saturday. You need to spend these 3 days. That is about 70% on high-rated areas. Next 3 days, Thursday, Friday, Saturday. Okay? Then you need to spend just 1 day on your medium weighting area. So that would be Sunday. Sunday medium weighting, and then only half a day on your low weighting. So maybe Monday morning, and that's it. Now you could change the order around. You could maybe from tomorrow, you just spend half a day on your low weighting flashcards. You don't need to read the whole thing, flashcards, whatever, a little quiz on low weighting chapters. Those of you on my course, I have loads of quizzes on all the chapters. So you could just spend half a day only doing low weighting chapters. That's it. That is it, guys. The next day, you spend 1 full day on your medium weighting. I would say just jump into, I know the medium weighting areas that are the most important that come out the most. If you have to read the medium weighting chapters, number 1, do contraception. Okay? Do your contraception. What is that chapter in the BNF? What is it, chapter 7? Contraception and your urinary. Very important. Those are the medium ones that come up. Number 2, the biggest of all the medium chapters that comes up a lot is your respiratory chapter. COPD, asthma. Smash them. Smash them. Then you always have questions on your cytotoxics. And you guys know those vincristine questions that always come up, right? Vin Christine, Vin Blasting. But 25%, that means from, or however you want to divide this, but it's one day. On that one day, what do you do between now and Tuesday? Guys, I'm giving you guys golden nuggets to help you. All you have to do is focus on COPD, asthma, adding contraception. One day, spend time on this stuff. Half a day, only half a day, maybe just the morning. Low-weighted chapters. That is literally about 8% of this revision. What do you do for the rest of the 3 days? Guys, high-weighted chapters. The nice chapters of the BNF. The nice chapters, NICE. N for nervous system, I for infection, C for cardiovascular system, and E for endocrine system. And your other high rating areas. So 3 days high rating, 1 day medium weighting, 0.5 of a day, half day on your low rating. Because this is all we have left. So I want to maximize your revision. So when you go to November 2024, it was still pretty much the same ratio. Do you think the GPhC is all of a sudden going to change this ratio for your year and just all of a sudden decide to give you high rating questions, 30% from the high rating area and maybe 70% from the medium rating? No, it's going to be the same. It's going to be the same, pretty much the same ratio, because that's what they've said and that's what they're going to do. So make sure you read the previous feedback from the previous exams. Make sure you read the previous feedback from the previous exams. For COPD, we need to know GOLD and NICE management. Learn NICE management. I think just NICE is the main one that will be tested now. NICE. As far as I know, NICE. I have to check those in previous shortcut scores. I know I didn't do the course. I didn't do the lecture for respiratory. I know the lovely Shireen did that for you on the private course. I had the lovely Lisa did that. So they will know better. But I think it's the NICE. I think you focus on NICE. Right? Double check. Don't go and say, oh my God, Mommy told me it was just NICE. That's what I think. That's what I think. All right. Okay. Marvin, what should we focus on low weighting chapters? I could have a whole session with you. Guys, if you guys want to have a one-on-one with me, one-to-one, like literally, I'm just going to put this email there, right? Because I can't really do everything right now with you. But let me put this down. If anyone is interested, yes? If you're really interested, like Marvin, I really want to speak to you privately. Right? I want us to just have a little one-to-one. And I just want to ask you a few things about this exam, my structure, my motivation. Send me an email to bnfcoach@gmail.com. My time is limited. I can only work with a few people before the exam. It's just going to be an hour or two, and we're going to sit down together. I'm going to go through your motivation. It's all about mental preparation and some things to focus on. But you don't want to go too much right now because the exam is getting close. It's not about reading a lot of stuff. It's really about preparing yourself mentally. Okay? If you want that mental preparation, if you want me to help you to be positive, to be confident, to go in there, that energy, that drive, that mindset for success, hit me up. Send an email to bnfcoach@gmail.com. Send an email and I will get back to you and we could arrange this. But it has to be ASAP because your exam's on Tuesday. We can only have that 1 hour session between now and I'll say Sunday. Okay, great stuff. So also with the previous feedback from the GPhC. So would you like to know the 3 things to remember about paper 1? So let's look at paper 1 calculations. Before I jump into cardiovascular, I want to give you guys some nuggets first. So type a 1 if you want to know the 3 things about calculations. So when people fail the calculations, guys, I promise you, I'm so confident because I've done this for so many years. I've worked with so many trainees. There is nothing that's new to me. I help anyone pass. Whoever it is, I've seen it all. Now, when people fail the exam, majority of the trainees that failed, they do not fail this exam and come out of the exam and say, oh, it was so difficult, it was impossible, that's why I failed. Students will always say that anyway, oh, this was the hardest exam ever. Even though they say that, the pass rate say 80%. It's ridiculous. Students like to exaggerate. Trainees exaggerate. Oh my God, it's the most difficult exam on earth. And then the pass mark ends up being 80% pass rate. But what most students, the reason why they fail is not because the questions are tough. It's simply because of little errors that they make. And most of them come out, they fail, not because it's difficult, but I failed by 1 or 2 marks, Marvin, and it was because I misread the question. Misreading questions is one of the highest reasons why students fail, both CARCS and clinical. Misreading questions. So most people that failed the exam by 1 or 2 marks, if you give them the exam again after the exam, they will get it right because they're going to read the question properly, and then boom, they're going to get that. So when I talk about your mental state, it's so important. When I do the sessions like now, the sessions I do now before with the trainees, I'm not teaching you all this stuff. It's too late to start teaching you the whole BNF. But what I'm doing is the most important thing now is your mindset. Because when you don't have when your mindset is not in the right place, guess what's going to happen? You're going to misread the question on the day of the exam. Doesn't matter how much you've learned. How many of you, when you're at university, remember a time when you walked into an exam, a question came up that you definitely knew, but for some reason, during that time in the exam, you couldn't answer that question? It's only after the exam, when you came out of the exam, you went, oh my God, I can't believe I got that wrong. Now the answer is coming to my head, of course. How dumb am I? How many of you had that experience? Type of me, type of me, type of me. So what happened there? Did you know the stuff? Yes. Did you have the knowledge? Yes. Had you read it? Yes. But what happened was your state of mind. You were not in the right mindset. You were probably stressed. You're anxious. You're nervous. Too much stress. So stress makes you forget. That's why it's so important that we make sure that our mindset is ready between now and the exam. The most important is your mindset. Number 2, reason why people fail is rounding up, right? 1 decimal place, the nearest pound, the nearest ml, rounding up questions, struggle with that stuff. Not because it's difficult, just because when you are during the exam, it's a bit more stressful than when you're just doing it right now. Pressure makes you misread stuff. And then finally is picking out the relevant things in the question or not seeing something that was so relevant in that question. So these are the things that make you fail, right? Not because the exam was so difficult, but that's why we have a way to help you so that on the day of the exam, you don't do these things. And that's why I really focus on the mindset a few days before the exam. So feedback again from the exam in November and June, this is combined. The students struggled in the same areas. Number 1, you could see cardiovascular, which we're going to touch on today. Treating cardiovascular conditions, primary, secondary, CVD prevention, including antiplatelet therapy. Guys, CVD, primary, secondary prevention. You need to learn this stuff inside out. Students struggle with this stuff in June. They struggle in November. There's a chance that GPhC might still test you again. Okay? They're not going to go, okay, students that struggle with this, we're not going to test them. They're going to make sure that, well, let's make sure the students need to understand this stuff because it's important. Indications and regimens for your anticoagulants, especially your DOACs. So indications, regimens, students struggle with this stuff. Enzyme inducers and inhibitors. So interaction questions. This is one area that you shouldn't struggle because we have mnemonics for this stuff. You need to know your enzyme inducers and inhibitors before you walk into this exam on Tuesday. Because when you know an inhibitor and you know an inducer, you can easily tell what the interaction will be, even if you did not even know the interaction beforehand. How many of you know your inducers and your inhibitors? Type of 1 if you do, type of 0 if you don't. Across board, I say my friend failed just by 1 mark in clinical. She smashed the calculation paper. Yes, yeah. Right now, my private course, I'm working with the trainees. We had sessions yesterday. We're going to have another session Sunday. We're going to have another session Monday. And all these sessions I'm doing with them is all to do with the mindset. It's all to do with the mindset. It's more important right now, your mindset, than trying to memorize everything. Oh my God, I've got to cover all these chapters before Monday. So Mary put in 1, you know, your inhibitors. I've got a lovely Vicky put in 0. Vicky, I really want to help you. I want to support you. I love your openness. Thank you for putting a comment down there. I appreciate that. Vicky, whatever happens, please make sure you learn your inducers and inhibitors before Tuesday. Okay? Please, 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 please do. It's going to help you because you will get interaction questions. All right? Please learn it. Please learn this stuff. Okay. Next thing is clinically significant drug interactions. Do you guys understand what this means? I mean, GPhC is talking about this. Do you guys understand what I mean by clinically significant? So in your exam, there are some drugs that will produce certain drug interactions. The GPhC is not asking for simple. They want to know the clinically significant ones. And the clinically significant ones, Jerry, I'll put that, are not just the most common. They're those that are really serious. So for instance, if you have 2 drugs that cause myelosuppression and they also cause nausea, you're not going to put down, the GPhC doesn't want you to put down, okay, the side effect will be nausea. No, myelosuppression will be the one. right, that they want you to mention. Those that are clinically significant, those that are life-threatening. You need to stop the medication. You need to counsel the patient on those. So, for example, we all give our antibiotics. All antibiotics and most of the drugs have a GI side effect. They could make you nauseous. But that's not something that you tell the patient, oh, stop, because this drug could maybe make you nauseous. You don't. That's quite serious. But you will tell them to stop, and you tell them to monitor, watch out for signs of bleeding, or the more severe symptoms. So the GPhC wants you to know the clinically significant drug interactions, clinically significant. And you will know this because those are the ones that you tend to re-advise patients on. Know the most likely adverse effects as well. And the second part is how to manage them. Right? I'll give you another clinically significant interaction that's quite common in the exam is your warfarin and your miconazole. That is a clinically significant interaction. Right? It could cause severe bleeding, it could cause hemorrhage. Right? Patient could die from this stuff. It is clinically significant. That's the answer you need to put down as opposed to, okay, the patient might have a little bit of hypotension. All your blood pressure tablets, when you guys are dispensing, you've got interactions all the time. Anyone taking amlodipine and an ACE inhibitor, there is hypotension, there is a risk of hypotension. Anyone taking a combination of blood pressure tablets, there are risks of hypotension, but you don't put that down as a side effect, hypotension, because they're taking 2 blood pressure tablets. Unless that's really what they want in the question, you know from where they frame it, but most of the time they want the ones that are more significant, okay? Maybe the patient might have some sort of angioedema or something. Okay, so know the most likely adverse effects. Know your MHRA updates. I have all this even posted free on my YouTube, MHRA updates. Those of you on the course, we have down the course updates throughout the notes. So know your MHRA updates because they tend to test you on MHRA updates. So this is the feedback from areas that students actually struggled on in these exams. This is just a few months ago, guys. And this is what GPhC is saying. And then safe and effective use of medicines. So it's just mainly your counseling, maybe using inhalers and things like this, or maybe advice on different medications, how to take certain medications. So it's so important you learn this stuff before your exam on Tuesday. Just look at them. Make sure that at least you're prepared. All right. Then, how should you structure your revision? I've already mentioned that to you. Please, 70% from now on, just focus on your high rating. No point messing about with low rating. One day with medium rating should be okay. And focus on COPD, asthma, contraception. Okay, now, strategies, don't need to go through this because it's not that time. I would have done this if we were a few months back. I will go into so much detail with this stuff with you guys, how you should read, what you need to learn. I would have gone through all those notes. We don't have enough time to give you all this information. What you need now is stuff between that you can do right now. Okay, right now. Okay, would you like me to show you the topics which have a very high chance of coming up in the cardiovascular chapter, type of 1, type of 1, type of 1? Because today's the cardiovascular system, would you like me? 306 of us on here tonight. Guys, if you have any friends, any colleagues, please send them the link to join today. Send them the link to join today. Because there's going to be no replay video after this. After this, I'll take this stuff down. I only want people that are serious people are going to be on here. Those that miss, then too bad. And those of you that are here, you're going to thank me for this a few days from now. Okay. Right. So get your friends, tell them, join. This stuff is crazy right now. So would you like, I'm getting loads of ones. So here we go. A formula that I use lots of mnemonics. If you don't know me, you know me for that. I am the king of mnemonics. Why do I use mnemonics? Is the best way to recall. The best way to recall. So those of you that know me, I've been teaching this on my course, my private course, my one-to-ones, everything I do. Cardiovascular system, the formula is called HAASS, HAS formula. The first H stands for hypertension, second H for heart failure, first A, arrhythmias, second A, anticoagulants, S for stroke, the other S is for statins. Oh, but Marvin, I think the only topics that are going to come up. No, these are the most common ones. What does this mean? This means that you must not walk into the exam without mastering these ones. These ones are your foundation for the cardiovascular chapter. You learn these ones first inside out before you learn anything else. Oh, but what about angina? Yes, it's important. But you have to add it. Learn these ones first, then add the others. Because these are those that have like 80% chance of coming up in your exam. There'll be questions on this. Okay? So learn the Haas formula. Take a screenshot of this if you can, because I'm not going to share this video later. So let's show you examples. So we're going to look at the Haas formula, and we're going to go through each of these, right? And this is what you really need to focus on. You know, when I said to you, you need to spend about 3 days now on your high-rated chapters, definitely spend days on these ones as well. Very important. These are the topics. Do we need to know Hasbled? Yes, but I think more of Orbit, because Orbit is becoming more popular than Hasbled. Definitely ChatVask. I don't read, you know how Hasbled parameters, but my gut feeling is the most likely going to ask you ChatVask or Orbit than Hasbled. Okay, let's jump in. Anticoagulants, let's use an example. Why are we taking anticoagulants, for example, from here on our list A? Why? Because it's a high-risk drugs. Your anticoagulants are high-risk drugs. Going back to the GPhC framework, you get loads and loads of questions. In fact, the GPhC framework says this. What does it say about your high-risk drug? What exactly does the framework say about high-risk drugs? Type in the chat. Amara Angel, I'm a bit scared to sit the exam. Oh my God, Marvin, I'm a bit scared. I'm scared, Marvin. I'm scared. Amara, let me give you some good news. Everybody's scared. You're not the only one. I was freaking out when I had to do my exam. Let me help you out, Amara, for a second. Who else is scared of sitting the exam? Type on me if you are. Yeah, like Amara, you're not the only one. This is the most common thing. Trust me, every single person. And if you're not scared, then you have an issue, because you should be scared because of this is a very important exam. So you should be scared, and you should have some anxiety. But here's the difference, Amara. Here's the difference. You should be able to act despite your fear. What you need is courage, Amara. And people that are courageous are not people that are not scared. The people that are courageous are those who, despite the fear, they're still able to take action. And what you need to say to yourself is that, yes, I'm scared, but this is not going to stop me from passing. Because even if I fail one question in calculations, I will still pass 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, sometimes 13, 14. You will still pass the GPhC exam calculations. What about clinical? Sometimes you can fail up to 36 questions in this exam and still pass clinical. So Amara, even if you fail 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30, 31, 32, all the way, you will still have a chance to pass the exam. So what you need, the lovely Amara Angel, let me send you something special. What you need is not to overcome your fear. It's okay to be scared. It is fine. But what you need, Amara, is to be able to say to yourself, yes, I am scared, but I am strong. And I will still pass the exam despite my fear. Because I know many people are scared. But I know many people go beyond the fear and they still succeed. And I know as well that every June, the pass mark has always been above 70%. Check, Amara, check. Men lie, women lie, numbers don't. Amara, check the numbers. Every June exam, I'm taking you back as 2011. The pass rate has always been above 70%. There was one exam, it was 95%. A few years ago, we had probably the most difficult exam. All the trainees were crying. It was the hardest exam. I marched to the GPhC. I organized a protest. It was in the news. It was everywhere. I organized a protest, the only protest that's been organized against the GPhC. And that was because students were crying. I sat with Duncan, with the team. I took 3-4 trainees with me. They were crying. We had a meeting. This was the hardest exam ever. Guess what the pass rate was at the end? 82%, right? So you, Amara, have a higher chance of passing this exam than failing this exam. You have a higher chance of passing the exam than failing this exam, especially if you're doing it in June. And there you go. Lisa says, I met Marvin there for the first time. Yes, and it changed my life. Yes. Lisa and I met down at the protest. Guys, I've been helping students for a while. I'm not someone who just comes for a little while and disappear. I've been in the game for time. You can see the pictures. Go to the CND and they'll tell you. I put myself on the line. Many people are like, oh my God, Marvin, are you really going to help trainees against the GPhC? What if they strike you off from the register? This is very terrible. Aren't you scared? Marvin, aren't you scared? I'm like, no, I'll stand up for justice. Like literally, if they're going to strike me off the register, let them strike me off. But I will stand up for the trainees and I will make sure that what is done is what is right, because we had some issues in that exam. But what I'm trying to say is, despite the hardships and the difficulty and everything, the pass mark, overall pass rate was 82%. So all of you in here have a higher chance of passing than failing, period. So exactly what I'm saying to you, what you need a few days from now, my prescription to you is not going and doing more past papers, more mocks, trying to learn all of this. What my prescription to you will be, work on your mindset. Believe in yourself. How are you going to cope with nervousness? How are you going to deal with this when you walk into the exam? Are you still going to be thinking the same thing when you walk into the exam? No, you need to have a different strategy. And your strategy has to be one of courage, one of confidence. You have gone through university. You have got an MPharm degree. 4 years, you smashed it. You smashed it. Literally, if your tutor has put you forward for the exam, this means you have the ability to pass. They're not going to put you down, put you for the exam if you are not capable. So the question is not, can you pass? Because yes, you can. The question is, will you pass? It's a question of motivation. It's a question of your mindset, right? All of these guys that are passing 70%, 80%, 90%, they were all stressed like you. I was stressed. I filled many mocks. I went on to, what's it called? The RPS stuff. What's the RPS question bank called? What's it called? What's the RPS question bank? Oh, it's gone off my head. What's it called? What's the question bank called from the RPS? What's it called? On Track. That's the one. On Track. Years ago, I did my exam years ago. I got on Track. Guys, I was failing almost all the questions on there. Few days before my exam, I did one mock and I smashed the mock. I was like, yes, I'm ready, I'm good, let's go. Then I did a second mock and I totally failed it. I thought, oh my gosh, I'm not ready. I was literally bipolar. I was bipolar. 1 minute I'm so excited, I'm ready for this exam. Next minute I am so not ready for this exam. My emotions were up and down. But the only thing that got me through was I got to a point where I said to myself, you know what? I will have the courage. I believe I'm going to pass. I know enough to pass. And I don't need to know everything to pass the exam. I can fill up to 36 questions in the exam and still pass. I can fill up to 14 calculations and still pass. If others have done it, I can do it too. I am Marvin. I am special. This is my destiny. I've put in so much effort. My families will be proud of me. I'll be proud of myself. This is going to change my life. No one is taking away my destiny. Bring it on. I believe in God. I believe in what I believe in, but I'm going to give this stuff 100%, and no one is going to stop me from becoming a pharmacist. This is what you need. This is what you need, and you go in there and you turn your dreams into reality. Don't play small anymore. So anticoagulants, this is from the GPhC. This is not from me. Yes, this is from the GPhC. Right? That's from GPhC website. So, and what they've written here, they generally ask. They didn't put this on here not to ask you, I promise. And I've tested this. I've checked, I've spoken to students after exams to see what they've asked these questions that they put on there, and they have. So on the anticoagulants, and you can rest assured that they will ask you questions in the exam on anticoagulants, and there will be a few of them, right? So first thing, what do you focus on? POM and OTC interactions. POM and OTC interactions. Examples: warfarin, miconazole. Think of all the blood pressure tablets that interact with OTC medications. Your blood pressure tablets and your Lemsips, your phenylephrines, your ephedrines, these sort of interactions, your NSAIDs, you need to learn them. Why? Because the GPhC loves to ask you questions, and I tell you guys this on the course all the time. The GPhC loves to ask you questions where a pump prescription-only medication interacts with an OTC med or a pharmacy medication. Right? Just the same way, like you're going to go like ciprofloxacin and an NSAID increases the risk of seizures. So always watch out for those interactions between a PMED, OTC med, and a pump. Side effects, how to recognize them is one thing, and then the second thing is how to manage them. Many students stop on how to recognize them. Oh, it causes bleeding. Yes, that's it. But the GPhC wants you to know what to do, how to reverse the bleeding. So warfarin, you need to know, it doesn't just make you bleed, but what do you do when the patient is bleeding to make sure they don't bleed anymore? How do you treat it? What do you do? What actions do you take? All right. So don't only stop on the side effect, also move all the way to how to manage and how to reverse the side effect. Counseling is very important. They might test you on counseling on warfarin or counseling with your DOACs. Right? Indications, your different anticoagulants, antidotes is a big one. It's coming up now in almost every exam. Doses are important. Right? So these are the main areas, and this has come from the GPhC. Well, how do you know predictions? This is what I'm telling you. They are there. The GPhC is giving you clues. Right? The clues are there, guys. But I understand if you don't know this, and the reason why I understand is because you're so busy. You don't really have time to go through this whole website and find all these things because you're just so busy. The only reason why I know all these things is because I have time. And I spend my time trying to make your life easy. And that's why I'm able to find all of these things and all these clues and spend so much time looking at patterns and all of this. I'm doing the dirty work for you. All I need you to do is just go in there and smash that exam. Okay, so please take a screenshot if you haven't yet. Make sure that you stick to this stuff. Right, so important areas to focus on in revision continues. Anticoagulants, please look out for warfarin, okay? Obviously, your DOACs are more popular now. Before, it used to be warfarin, so we used to get loads and loads of questions on warfarin. Now I'm noticing it's more questions on DOACs. However, they still ask questions on warfarin. So definitely your INI is important, knowing when to restart, when to start again, what to give, when to give vitamin K, when to give plasma, frozen plasma, and things like this, okay? When to withhold the medications, you need to know this stuff with warfarin. Okay, DVT risk factors. So you need to know your risk factors for DVT, things like obesity, cancers, all of that stuff, being immobile, surgery, your lifestyle, all the risk factors that can make you have a blood clot. Okay. CHA2DS2-VASc, you need to learn your CHA2DS2-VASc. You need to know what every letter stands for. And you need to know your scores as well, because they may give you questions where you need to work out a CHA2DS2-VASc score. But it's not enough to only know the score. You need to also be able to interpret the score. And same goes with orbit. So if someone has a score of 2, what does that mean? Right? So if they have a score of 2, if it's a man or woman, no matter, you have to give them anticoagulants. So you need to know what to do, what the scores mean, and how to interpret them. And part of your high rating areas is knowing how to interpret results. Okay? Very, very important. Very important. Then you have DOACs. You have DOACs, doses. Now, someone asked me this question once with your DOACs, like, oh, Marvin, what should I learn? Like so many DOAC doses. And I tend to give people shortcuts. That's why it's called period shortcuts. I remember when we started period shortcuts, I used to have, it's like 9 years ago, I used to have all these weird pharmacists come to me. Oh, Marvin, you are teaching students shortcuts. That's not right. You're not helping them become proper pharmacists. You're showing them shortcuts to become pharmacists. I thought, what? How stupid are you? Are you meant to be a pharmacist? You tell me, when you did your exams, did you use mnemonics to pass? Yes. Did you find books that were easier for you to understand? Yes, I did. Did you get somebody to explain something to you in a better way because you couldn't understand previously from other ways? Yes, I did. Did you use like certain active recall strategies to help you to remember information easier? Yes, I did. That's a shortcut. That is what I do. We're not giving them information, but we're giving them information in a way that is absorbable, that they can remember, that is fun, that's interactive. This is what shortcuts is all about. Right? So when it comes to DOACs, you look out for your stroke doses and your VTE doses. the stroke doses tend to be double most of the time. And then you have things like important DOACs to focus on that tend to come the most. We have 4 of them. What are the 4 DOACs, guys? What are the 4 DOACs? Q-risk is important to learn. CHA2DS2-VASc is important to learn. What are examples of your vascular diseases with CHA2DS2-VASc? You got peripheral artery disease. Yes, so read. Those of you on my course, you know we always use mnemonics. That's an example of a mnemonic. So people ask me, why are you doing shortcuts? I'm doing a shortcut because it helps them learn. Read. That's what it is. Rivaroxaban, edoxaban, apixaban, dabigatran. Easy to remember. Read. Right? So of all this, all of them are important. But the ones that tend to get tested the most, I would say, will be rivaroxaban and apixaban. Definitely want to learn those doses, especially when to halve the apixaban dose, for example. Okay, when to reduce the dose. What are the conditions for you to reduce the dose of apixaban? The ABCs of apixaban. I don't want to go into lectures right now. There's no time for that. It's no time for lectures, but I'm just giving you clues what to go and look for. Okay, make sure, especially apixaban and rivaroxaban. Yes, read Marvin's notes. That's it. Read my notes and you find all these things in there. Easy to listen to. Yeah, like Lisa, the one and only Lisa. Lisa is a darling. Guys, we're so fortunate to have this girl. Honestly, like I've seen Lisa go through struggles, failing the exam, crying. I've seen Lisa almost losing, giving up on this exam. But I've also seen Lisa going through those hardships, pushing herself, turning up in every lecture, even though she struggled, even though she'd failed the exam. She came again, she failed again, she came again, she believed, she was scared, she was anxious, but she gathered her courage. She said she was going to pass. She was going to do it. She pushed herself. And not only did she pass the exam, she then came back to help as many trainees as possible so that they too can pass and not go through what she went through. This, ladies and gents, is very, 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 very amazing to me. This is what makes this lady special. Very special. So listen, people, sometimes the only one to drag you down. What you are doing is best. Keep working hard and listen to Mark's advice. Someone who actually cares. Period. Shortcuts is the way. Guys, all here for you. You're going to do well. You are going to all do very well. So we look at CHA2DS2-VASc, look at your DOACs, mechanism of actions of your anticoagulant. All of these things might look like, oh, I have to learn all of these things, but it's very easy because I use so many mnemonics to help you. So let's try some of this. What example of DOACs? We always said read. Just remember read if you remember all of them. Rivaroxaban, edoxaban, apixaban, dabigatran. I omitted an N there, sorry, is dabigatran. Next slide. Know your mechanism of actions. Right, so you need to know the mechanism of actions as part of your high rating areas. Is there anyone that doesn't know the mechanism of actions of your DOAC type of me, type of me, type of me? Anyone that doesn't know? Well, it's very easy to learn because all the ones that have XA in them are reversible inhibitors of factor XA. So that's how they work. Apixaban, rivaroxaban, edoxaban, all have XA. Sa, thank you for putting your name down. So SA, Sa, right? Let's just call you XA. So SA, just think about XA, right? If it's got XA in its name, then it works as a reversible inhibitor of factor XA. These are all like sort of clotting factors. Now, the only one that doesn't have an XA in the name is which one? The last one, dabigatran, right? Dabigatran doesn't have any XA, and it's a reversible thrombin. So TR, it has a TR there, and thrombin, TR inhibitor. Okay, little ways to learn. Don't kill yourself. Use shortcuts. Use shortcuts. Which of these does not have a reversible agent, ladies and gents? Who are those that are my course? Who are those? Let's see what Lisa put down there for you guys. I passed on my last attempt. She passed. The lady failed the first time. She picked herself up. She failed the second time. She picked herself up and she smashed the third time. Look at what she got the third time. 34 out of 40, 96 out of 120. And I remember Lisa struggling so much with calculations. I remember Lisa saying calculations was her weakest point. She isn't that true, Lisa? She literally failed. She struggled with calculations. She's like, I'm really struggling. I can't pass calculations because I think her first exam, she had like maybe 10, like 10 out of 40. She had about 10 out of 40 in her calculations exam. But at the end, this lady smashed it, right? And if she can do it, you can do it too. Believe, guys, believe in yourself. So which ones which of these doesn't have a reversal agent is ED, right? ED doesn't have a band. Those of you on the course, you know this stuff. And many people remember things like this from stories. That's why I teach a lot of stories. Yes, Lisa used to get 10 out of 40. 10 out of 40 she used to get. In her final exam, she had 34 out of 40. By the way, don't worry in your mocks. Those of you that are failing mocks, don't even worry about it. Because I failed so many mocks and still smashed the exam. And many people, I'll probably say maybe about 70 or 80% of trainees fail a lot of mocks before the exam. They won't talk to me about the Buttercup's mock and the Pro Farmers mock. Because these are ones that people just fail, standard, but still pass the exam. So don't even worry about that. So Edoxaban is the one, poor Ed. Poor Ed. Ed is so cute, isn't he? Look at Ed, such a cute little boy, but he has no band to play with. And that's what, just remember, Ed doesn't have a band, Edoxaban. All the other ones have reversal agents. Why is this important? Because every single exam in the past few years, they've asked one question on a reversal agent on one of these drugs. They've asked one question. This one question that I get sometimes, Marvin, which mocks are good to do? What would you say? Can't tell which ones are good quality. Which ones are good to do? What would you say? Mocks are mocks. They're not a true reflection of a GPhC exam. And I can give you about 10 reasons if I wanted to right now to tell you why you should never place your performance just on a mock paper. You want me to give you some of the reasons? I'll give you some of the reasons. Number one, the mock papers are designed to be tough. Because we think that if we make it a bit tough for you, then that means that if you get 70%, if you get 60% in our mocks, then it'll be equivalent to 70% in the actual exam itself. Number two, the GPhC doesn't think like the people that set your mock papers. They don't think the same. The GPhC is not trying to trap you. They're just trying to make sure that you are ready to work as a pharmacist from the first day. So they're asking you things that are regular, common things. Common things are common in your GPhC exam. The mocks were trying to trap you. So we're going to ask you some things that are uncommon, some weird questions. Number three, all our mocks, we don't have many people. It doesn't go through a multi-review process like the GPhC does. The GPhC goes through a multi-review process. That means that many pharmacists sitting down, going through the questions, double-checking those questions, making sure there's no ambiguity. These other mocks don't. How many of you guys do mocks and you look at them and go like, oh, this stuff is not right. This question is not right. They've done this wrong. Another thing is the GPhC, every single exam, when they're marking the paper, if they find a question that is ambiguous, something which, oh my gosh, there are two correct answers here, they're going to remove that question from the exam. That's why when you look at most GPhC exams, even though you're doing it out of 120, most of the time it's marked out of 119 or 118. They will literally remove so they can adjust certain things. Okay, mock papers don't do that. If you did a mock paper myself or with Pro Farmers or with Buttercups and you got something wrong, but it wasn't really your fault because it was ambiguous, they don't come back to you and say, oh, by the way, Dreamer, by the way, I just want to let you know that we were wrong. This was a bit ambiguous, so we're going to remark your paper and actually you've passed. No, they don't tell you that. GPhC does. GPhC also changes. There's not a fixed pass mark for the GPhC as such. It's also based on the performance of that year. So the pass mark could be 70%, or it could be adjusted to 68%, right? Or it could be higher. It changes also based on the performance and the reaction from students. Mocks don't do this stuff, do we? We don't do this. We just give it a mock and it doesn't matter. If you gave a Buttercup's mock now and a Pro Farmers mock and say about 70% of trainees failed, no one changes that mock. That's never going to happen in the GPhC exam in June. If that happened, they'll sort of adjust. If 70% of trainees have failed, only 30% have passed the GPhC exam, there will be some adjustments done. Okay? So my point is, it's always good to do questions. They help you regardless. Questions are important. They help you to revise. They help you to test your knowledge, and they're good for you. So you do as many questions as you want as possible. Okay? But there's no specific training provider out there. I'm telling you, this is a fact that consistently the questions are exactly the GPhC exam questions every single year. Exactly. If that's the case, then these guys need to be done for because they're probably leaking some information to them from the GPhC. So you might see most of the time is fluke. And I'm honest with you. You might have this year, someone might tell you, oh, you know what, 2025, wow, most of the questions were actually similar to the previous shortcuts mock. Then you have another exam is done in 2026, and they're not similar to the previous shortcuts mock. They're actually similar to Pro Farmers that year. All of a sudden, the year after, that Pro Farmers is not similar anymore. It's similar to Buttercups. So if you look at that, you wouldn't see a company that consistently, oh yeah, every single year. Yeah, 2020, 2022, our mock was the same like GPhC. 2023, oh, it was the same like previous shortcuts. Oh, 2024 it was the same. Oh, June and November was the same. No. Okay. But yeah, but in terms of the top ones, I could give you the most popular ones that you want to have in your list. Previous shortcuts, definitely. Green light pharmacy, these are the ones that people tend to do. Pro Farmers, people tend to do. Buttercups, I find that people do Buttercups, and many people complain that it's just too tough. It actually kills their confidence. That's why I hear from trainees anyway. These are common ones. RPS mock, do it. People talk about Bradford, the Bradford mock. People say it's good. Kill mock is good. The main thing is try to do about 12 to 15 mocks before the exam. Right? And in that list of your mock papers, make sure you have Buttercups in there if you want, have Pro Farmers, have previous shortcuts, do as many questions as possible. Okay, Dreamer, just helping you out. So do the questions, but don't worry about looking for that specific provider. Yes, this specific provider, the questions are really, really similar to GPhC exam, because if you do that, you'll be shocked. You're going to examine that provider this year isn't. It was maybe 2 years ago, but it's not this year. But as long as you do many questions, you'll be all right. You will be all right. So reversal agents, learn them. Apixaban, rivaroxaban, they always come on, but they tend to come out a lot now in the exam. I use mnemonics, they end with AN, so that's andexanet alpha. Andexanet alpha. Yes, you're the provider king. Yes, and I'm just being honest with you. Our mock is very good, and you could see even the reviews are on Trustpilot. We had trainees that did the mock last year, and many of them left the exam and they said the questions were very similar. And many students said the previous shortcuts mock was similar to the GPhC exam. But I'll be liar to come and tell you that, oh yeah, maybe I have a specific inside information from the GPhC. Yes, it was similar, but we don't know what it's going to be this year. We're still hoping it'll be the same because we're still working on the same patterns. But I cannot really tell you guys, yeah, I have the GPhC masterpiece with me. So every year we are definitely, unless we're leaking our information, GPhC is leaking our information to us. But we always tend to get it right. We always tend to get it right. Okay, learn your reversal agents. Please do. Warfarin, for example, reversal agent warfarin is vitamin K. Vitamin K kills warfarin. What happens when your iron is high? Where is man like Jerry? When your iron is high, what happens, guys? When your iron is high, what happens? Someone says, if you pass the previous shortcuts mock, do you think there's a good chance you pass the actual exam? I do. And I think not only the previous shortcuts mock, right? I think if you pass the mock and you're also doing other mocks as well, right? If you pass the previous shortcuts mock and you did other mocks and you're passing the mocks, maybe you're getting anything above 68%, 69, 70%. It's not just one mock. You want to do like 1 or 2, 3, 4, 5, 6, 7, 8, 9, 10. And if you're consistently, you will know anyway. If you're consistently getting around the 70% mark and above, then you're in a good place. Then there's no reason why you're going to fail the exam. So I'm not into this business of saying, hey, listen, if you pass Pro Farmers, that means you're going to pass the exam. If you pass just previous shortcuts, you just do previous shortcuts mock and you pass it, yeah, that's it, you're going to pass the exam. No, do a number of mocks and also practice a number of questions. Do lots of questions. It's a combination of all these things that make you pass. Practice. Remember when I said to you, practice. Questions. If you can do as many questions as you can, do them. It only increases your chances of passing. I was doing a one-to-one with a trainee. A trainee had failed the exam twice. She'd failed the exam twice. And I was going through her whole strategy, how she's been revising, trying to find exactly what I need to tweak in her whole process to help her pass. And what I found out was she wasn't doing enough questions before the exam. She didn't do any mocks. I think she did one mock. She didn't do enough questions. So you know when I gave you guys the golden number, 1,200, she probably done like 200 questions. That was it. So all we did, she did exam in June, she failed. She had a November exam. All I did with her was I tweaked the number of questions she was doing. We practiced and I told her, you need to hit 1,200 questions and even go higher if you can. And so the only thing she changed was more past papers. She moved from doing just about 1 or 2 marks before the exam to hitting the 10, 11, 12 mark. Before the exam, about 1 month or like 3 weeks before the exam, this girl was buzzing. She was a different person. That Marvin, I can't wait for this exam. I just feel like the reason why I definitely failed was I didn't practice enough questions. And she went to the exam and she totally smashed it. Totally smashed it. Don't underestimate the power of questions. Just do them. And in these final days, it's all about questions. It's all about flashcards. It's all about summary notes. Active recall. Which the work should be taken with food and what strength? Which DOAC and what strength? Let me know. Which DOAC should be taken with food and what strength? Let me know. So let me know. So I'm going to advise you guys, get the previous shortcuts mock and do it. It's a very good mock. It's a good mock. Add it to your portfolio of mocks if you haven't. All right. Get it and do it. Test yourself. I think it's currently half price. I think it's half price. I think it's half on the website. I'll put the link on there. It's in the chat. All right. Get the previous shortcuts mock. Do the mock. It's all online. It's all like the GPhC in terms of the features on the website, the way it's been developed. So you can flag questions up, the colors, how you move around. It's to simulate your actual GPhC exam itself. That's how it was designed. And you get the answers instantly, and then you have about 2 days to review it. If you want to practice and you've not yet, try one, do it under exam conditions, time yourself and see how you perform. Right? And see how you perform. Hopefully it will be positive. Learn your MHRA warnings. So which DOACs are relative 15 and 20 milligrams, that's correct. So your rivaroxaban, the high doses, okay? It's not the low doses. They could give you that in the exam. They've done that before. 5 and 10, would you not just say take it with food, but the lower doses are fine on an empty stomach. It's normally the higher doses, 15 and 20. Which DOAC causes headaches as the common side effect? Rivaroxaban. It's a rock band. Think about rock music gives you a headache. Well, it gives me a headache. I don't know about you. You might be a big fan of rock music. I'm not. Rock music just sends me mad. I'm like, oh my gosh. So it gives you a headache. So best way in the morning to remember that is Rivaroxaban. It gives you a headache. It's Rivaroxaban. Gives you a headache. Guys, I love teaching. It's fun. I love teaching you guys. Learn how to interpret results. Okay. So all these things I'm showing you are also high rating areas. Remember, I said to you guys, 3 days. Spend the next 3 days on high rating areas. Forget about the medium, the low rating. 1 day on medium, asthma and COPD, contraception. Low rating, half a day. Half a day. When you ionize high, you bleed and die. Okay, we ionize high, you bleed and die. This is a very important table to learn. This is from the previous shortcuts course that I did. Please learn this table because GPhC, I mentioned, they don't only want you to know what happens in terms of side effects. They also want to make sure that you know what to do to reverse the side effect. Okay, they want to make sure that you know what to do when things happen. So, patient is come to pharmacy on warfarin, has bought miconazole, Dactarin gel, has taken it. The INR is now sky high. The patient is bleeding. What do you do? Right? So what is the INR? You need to know. If the INR is greater than 8, then you stop warfarin. But what do you have to do? You have to give them vitamin K. But it's not just any type of vitamin K. It has to be the injection. And then when do you start again? You start when the INR is less than 5. So this table is key. You have to learn this stuff. Okay? You have to learn this stuff. Yes, the precious cost mark is 75 pounds. Yes. It was 150, but 75 pounds at the moment. Okay. Interactions that come up, take a screenshot. I don't want to go through all of this stuff. I've put in so many slides. I've put in so much. How many of you guys can see how much work I've put in for you guys for this session? Can you guys see how much work I've put in? Like the amount of slides I've got. And this is cardiovascular. Like I've really decided I really want to help you. Put in so much work in the slides. Warfarin interactions. These are the main ones that tend to come up. Metronidazole is obviously the one that comes up quite a lot. Other things that you need to know is warfarin, clarithromycin. Clarithromycin is an inhibitor, so just know about your inhibitor interactions. Juices, cranberry and pomegranate juice, you want to avoid those. And then just the advice that you give in terms of green leafy veg. So you can still have vegetables, just don't increase or decrease your regular amount. Okay, great stuff. Smashing it, yeah. 300 plus slides. So yes, so my cardiovascular lecture itself, I told you guys on the previous shortcuts, is 12 and a half hours. 12 and a half hours. But it's good and concise though. Oh, Marvin, 12 and a half hours, that's that much. No, you won't even notice it. When I do sessions, how many of you, when I do the sessions, we are on the course. I used to be on live sessions with trainees for 3 hours, guys. And the reason why I was on 3 hours, not because I wanted to stay 3 hours, the trainees were like, no, continue, Marvin, don't stop. We used to do sessions. The session is 2 hours. I'll get to 2 hours. And my guys go stop. They said, nah. Let's keep going. Let's keep going. We're buzzing. We've got energy. We're laughing. The mnemonics are flowing. The topics are being broken down. The loving learning. And this is after a long day of work. And like, no, Marv, let's go on. So those sessions ended up being like 2.5 hours, sometimes 3 hours long. And you won't feel it because we had so much fun in those sessions. So a big one that you need to learn is definitely stroke. And I did this on YouTube. I still have a video on YouTube on the updates. I don't want to go through the whole updates on stroke. But the fact that there's updates on stroke, you have to watch out. And it's also part of our HAS formula, right? One of the S's was stroke and the other S was statins. So I use ASAP as my mnemonic in terms of the drugs that you give in stroke. ASAP, A for antiplatelets, S for statins, anticoagulants for those that got DVT or PE, and PPIs. Good mnemonic to use. Okay. Someone's asking, is doing 1,200 questions from the previous shortcut question bank and also the mock and okay wait? Yes, absolutely. Absolutely. Those are good numbers. If you do like the previous shortcut question bank, because we have over 1,000 questions on there, and you do the mock, you're literally hitting your numbers. Right? So it's doing them and then also learning from them, right? Doing them and learning from them, you're in a good place. In a good place. And the more you could do on top of that, it only gives you extra to walk into that exam like a king. I'm talking about walking into the exam like the boss, guys. Symptoms of stroke, you need to know your symptoms of stroke. They come up as well in the exam a lot. Be fast and mnemonic balance, the eye, face. Most of you guys know this stuff. Time to call 999. Then heart failure. I mentioned HAS formula. I said hypertension, heart failure, arrhythmias, anticoagulants, stroke, and statins. Heart failure, I've got mnemonic, this bad man. See this bad man over here? This is my mnemonic for heart failure. D is for digoxin, I, ivabradine, S for sagabutril, B for beta blockers, A for ACE inhibitors, D for diuretics, M for MRA agonist, A for anti-diabetic drugs, such as which anti-diabetic drugs do you use in heart failure, guys? They could test you on this. So your drugs like dapagliflozin. If you see dapagliflozin, a patient taking it, please don't just assume that that patient is diabetic. They could be taking dapagliflozin for heart failure. Nitrates and hydralazine. So that's the one that can help you in the exam. This bad man. What drugs are used to manage hypertension? You always get questions on hypertension. You always get questions on hypertension. There's no doubt about it. No doubt about it. Just 1 second, guys. Right, back on there. Sorry about that. It's just a bit hot. I had to open the window a little bit. So, yes, so you need to know your hypertension drugs, and they always ask loads of questions. That's a fact. Right? And you also have the service. You're definitely going to be getting loads of questions on hypertension. And so this is the table. You need to learn this algorithm inside out. I call it ACT and CAT. So ACT is ACT and CAT is DAT on the other side. So I don't want to go into all of this right now to start explaining you all of this. But the main thing is make sure you learn this algorithm, because almost every single GPhC exam, there is definitely going to be questions on hypertension. And those questions tend to come from here. And the second thing that is the most important, this is the source. Guys, type in source if you want me to give you the source. The next thing when it comes to hypertension, I'm about to show you a table that this table is really where majority of the questions come from when it comes to hypertension. If you want to see the table, just type a T for table. Just type a T. I've got source. Okay, you guys want to go for source? Go for source then. Right, just type a source if you want me to show you my source. This table is gold. This table, take a screenshot if you can. I promise you 100% that the questions they tend to ask you will be related to this table. So let me show you this table. It is magic. It is gold. So this table, take a screenshot, guys. Take a screenshot now, because this is where the magic happens with hypertension. This is where those questions come from. Now, the only thing I need to warn you about is when you see it say over here, avoid, add caution. So it could be avoid or caution. The reason why I'm saying that is because I don't want anyone saying, oh, but Marvin, it says avoid ACE inhibitors for African Caribbeans, but why do we give it if they've got diabetes? Right. So when I say avoid, it just means you could have certain side effects. So if you're going to give an ACE inhibitor to these patients, then it's caution. So avoid stroke caution. The reason why this table is so important is that the GPhC love to ask you questions from this algorithm. But when they ask you these questions, they want to make sure that you know the different steps, and you need to know the contraindications so that you jump onto the next step. So contraindication could be, for example, if a patient's got diabetes and the patient is Black African, what do you give them? What is the first line? Do you give them a calcium channel blocker because they're Black African, or do you give them an ACE inhibitor because they've got diabetes, right? So you normally give them an ARB preferred for Black Africans, right? So it doesn't matter. Whoever is, whether the Black, whether the white, the Caucasian, as long as they got diabetes, we'll always start off from ACT. We'll always give them an ACE or an ARB. It doesn't matter, okay? For renal protection. So we'll always give them an ACE. Now, GPhC likes to test you where, for example, there is a contraindication in the question with calcium channel blockers, and they want to know what is the next step. It will be this one. So you need to know all your contraindications with these drugs. So they love to test you so much on contraindications from this algorithm. And that's why this table is key. Where will those contraindications be, or those cautions, or what to avoid? Here they are. So it could give you an ACE inhibitor, something to do with an African Caribbean, and we're not going to give them an ACE inhibitor. We're probably going to give them the ARB, or we could avoid the ARB and we'll give them a calcium channel blocker. Or they could give you something, for example, calcium channel blockers. You don't give them the people that have got heart failure, except I'm not the pain, but generally we just try to avoid calcium channel blockers in heart failure. So give you an example where a patient has got heart failure and you want to treat the hypertension and they are African Caribbean. So patient African Caribbean is 65 years old. They will naturally be given a calcium channel blocker, but they might just put in there that patient also has a history of heart failure. In that case, we cannot give them a calcium channel blocker. We're going to move to the next thing down, which would probably be an ACE inhibitor. So that's why this table is gold. So you have to go through all of this, all these contraindications they tend to ask in the exam when they're trying to test you on that algorithm. And I can bet you 100% you will get a question from the algorithm, okay? Either optimizing a dose or the next step. So important, take a screenshot and you'll be good. Arrhythmias was the A, right? You always also get questions with arrhythmias. Whether it's to do with Chad-Vas calculation, whether it's to do with Has-Bled, whether it's to do with orbit, whether it's to do with rate control, rhythm control, they love arrhythmias. They love arrhythmias. They love arrhythmias. Okay, so very important. What is an arrhythmia? What is an arrhythmia? What is an arrhythmia? So an arrhythmia, if you look at the word, at the start of it, it says an A and two R's. That's the clue. It's A is for abnormal, the first R is for rate, and the second R is for rhythm. So it's an abnormal rate and rhythm of the heart. That's what an arrhythmia is. So that's your memory trick. Arrhythmia, ARR, A for abnormal. The first R is for rate, and the second R is for rhythm. Right? Very good mnemonic that put together to help you. Now, what I wanted to learn is in the exam, a few times they've asked which drugs are used for rate control, and in different papers they've asked which drugs are used in rhythm control. And here's the good news for you: the GPhC tends to repeat questions. They do repeat questions. I have seen many trainees that questions that have come in June have also come in November, or questions that have come up 2 years ago have then come up again. All right, so there's a possibility that you could have a question on rhythm and rate. So guys, what drugs are used for rhythm control? So we're about to finish this now. What drugs are used for rhythm control? that's a good one. Mawuli says it's until the exam. I like that. Katie's like, how long is the session? Katie's, how long you want it to be? Katie, are you tired? If you're tired, then you're not ready for this. This is it. You cannot be tired these days. These are the last sessions to your exam, to the biggest day of your life. This is when you stay up. This is when you do every single thing to pass. Fabulous rhythm, exactly. Fabulous rhythm. Those are in a combo course. Fabulous rhythm, FAB, because we like music. The music is fabulous. The rhythm is fabulous. So think about fabulous, SFAB. Flecainide, amiodarone, beta blockers. You can use sotalol as well and dronedarone, but the main ones are those three. All right. Diabeta for rate control. So please learn those. Just learn those. It's going to help you. We're almost finishing. Another area that they need you to learn is learning your diagnostic and physiological tests. Okay. So a patient has been diagnosed with AF. What is the most accurate tool to predict his risk of bleeding? Look at Jerry, guys. Look at Jerry. Jerry is in Malaysia and it's 3:30 a.m. This guy is still up. It's 5 a.m. and he's always on. He's always on. He stays up for this stuff. This is how you pass. This is how you pass. You know what they say? They say life, you don't get what you want, you get what you deserve. You're not going to get what you want. What you want is a pass, but you might not get that. You get what you deserve, right? Not what you want. And what you deserve is what you work hard for. And that's how it works. So you want to get a pass, you need to stay up. Make it happen. Okay, so did we get this correct? So most of you went for orbit. Great. Has everyone taken out some days off work, by the way, before the exam? It's a must. All of you should have taken days off. I hope there's no one working. And I'm serious about this. No one working. If you try to take time off and your manager wouldn't give you, call in sick. Literally call in sick. Oh, Marvin, you told a trainee to call in sick. It's the most important exam of your life. It's the most important exam of your life. I had a trainee that failed this exam, and the trainee failed the exam. Why? Because they were spending all the time doing all these extra hours at work. All the time. They're just doing extra hours, even though they didn't have to. Oh, the manager needs me. Manager needs me. Manager needs me. And they were doing all this work and then they failed the exam. But when they failed the exam, guess who came to see them? Guess who was there with them? Nobody. All of those guys in the pharmacy moved on. Life continued as normal. This trainee was crying by herself. What I'm trying to say to you is this is your life and only you are responsible for this. So you're better off putting everything away and making this the most important thing. You're better off calling in sick and passing and becoming a pharmacist as opposed to going in there, doing all of this stuff and then failing and then saying, oh, I failed because they wouldn't give me any time off work. Your manager wouldn't even say anything. They'll say to you, but you knew it was your exam. Why didn't you do something about it? That's how this world works. Nobody cares about you when you fail, guys. I'm telling you the truth. Nobody cares about you. Not all these people in the pharmacy smiling with you. Oh, you're all right. Your dispensers are like, oh, you're all right, man. All right. You're helping, you're dispensing. All those patients are like, all right, love. And you're like, oh, yes. If you fail, none of them, they might just say to you, oh, I'm really sorry to hear this. But guys, they're not going to lose any sleep. Their life continues as normal. The only one who's going to lose sleep is you. Right? It's your life, it's your future. You're responsible for it. Everyone moves on. It is a fact. It is the truth. Whether you like it or not, it is the way it is. It is the way it is. Nobody will be there for you when you fail. And the same thing, even when the results come out, the day when the results come out, there'll be many of your colleagues that will be celebrating. Oh, I passed. I'm so happy all my life. I'm so happy. I'm so happy. And if you fail, you're just going to be there by yourself. While everyone is celebrating, everybody moves on. That's how it works. So don't sacrifice your exam to try to please people in the pharmacy. Not now. You could do that at the beginning, not now. Right now, the only thing that's important is you. Be selfish. Be selfish. It's important that you're selfish for the last few days because it's a life-changing experience for you. What about this question, guys? Mr. X has just had a blood test. His results show a high cholesterol. What answer did you guys go for this question? This has come up in the GPhC exam before. By the way, guys, I mentioned earlier, if any of you, and I'm serious about this because this is going to really change things for you. If any of you here has done some work, but you're really anxious, you suffer from anxiety, you're scared, you need motivation, you just need someone to go through with you, ways to deal with your anxiety, getting you positive for this exam, walking in with the confidence because this is what you need to pass, then send a message to this email. Just send me a message and we could arrange a session. But again, sessions are very limited because it has to be done between now and Sunday because you don't want to leave things the last day. This is only if you are struggling with your confidence and you really need that extra push. Then if that's you, then all you have to do is just send an email to this email address, bnfcoach@gmail.com. Great, Jerry, you've emailed, that's fine. Very good, very good. Okay, so I'm almost finishing this. The correct answer, what do you guys have for that? So correct answer is creatine kinase. Well done, well done. This is creatine kinase, D. I'm seeing lots of D. Well done, GPhC question. What about this one? So on slide 45, and I think we only have about 3 more slides left. What about this one? Ms. D, 16 weeks pregnant and suffering from hypertension and asthma. Which medication below is the most appropriate to treat her hypertension? I've got D from Amara. I've got D from Yara. I've got D. I've got E from Rafa. I've got D from Zia. I've got D from Erica. I've got E. I've got E from Becca. Wow, there's 265 of us on here. That's a lot. A, okay. A from Erin. All right, interesting. So you get questions like this in your exam, and it has come up a few times. So be very careful with pregnancy questions and breastfeeding. So the correct answer in this case is you have to think about the first line. Yes, the first line is labetalol. That's correct for pregnancy. Then the second line is MR-nifedipine, and then the third line is metal-dopa. Okay. But in this case, although it should have been labetalol, that patient is suffering from asthma. And because the patient's got asthma, we're not going to give them labetalol. We're going to go to the second line, which is MR-nifedipine. That makes E the correct answer. I like that, Jerry. I got this wrong the first time, but not anymore. And Amara, the same as well. Change your answer, which is good, right? So let's just make sure that on the exam day, we get this right. Right, the final part is statins. Okay, you get questions on statins in every exam as well. There either be questions on timing of statins or something to do with the monitoring. The lot of questions on the monitoring of statins. Patient counseling, some do interactions on statins. Patient counseling, contraception and conception advice, pregnancy, interactions, intensity, and CVD prevention. Okay, these are the main areas they tend to test you on statins. So that's it. I was going to put, are you ready for CARCs? But we're not doing CARCs today. We're going to stop there. So guys, we have spent over an hour and a half, almost 2 hours on the cardiovascular, trying to show you what to focus on. I really hope that this session has helped a lot of you. And I hope that you build that confidence in yourself to know that in these last days, it's not really about how much you learn. It's about building your mental state. It's about having that confidence that, yes, I am ready. But you will never get they will never get to a time, and I can tell you right now, straight so you know, you will never get to a point before this exam on Tuesday where you've read everything. You will never have that feeling of I know it all. There's always going to be I still need to learn more. And the more you learn, the more you need to learn. That's how it works. The only thing that's going to save you is the confidence to say to yourself, stop. That's the only thing. You have to say to yourself, this is it. And believe and have faith that what you've learned to this point is enough to get you to pass. It may not be the perfect, like you know everything. You may not know everything in the BNF. You may not have covered everything that you wanted to cover. You may not be as good as in all the calculation questions that you truly want. But the good news for you is you don't really need to know everything to pass. And you need to just have that belief, that faith, that what you know now will see you through. And start developing that mindset that if others have done it, you can do it too. Remember, every single June exam, the pass rate has been above 70%. And even those that fail this exam normally fail by either 1 or 2 or 3 marks. And even those that failed, most of them failed not because the exams were difficult. They will tell you because most of them either had set personal issues in their life. Perhaps they were not well leading up to the exam. They had a loved one that wasn't well. They had a relative, someone that passed away. They were going through a very tough time, maybe even a tough placement. They were mainly these external factors or did not get enough support that stopped them from passing. And the moment they got that support, they passed the exam. Okay, so wishing you guys all the best. Stay positive, keep going, believe in yourself, be confident, have the courage. Amara, I need that confidence, Amara. Have that confidence. Don't be scared. Let the exam fear you. Don't fear the exam. Let the GPhC exam fear you because you were born to be a pharmacist. Turn that dream into a reality. Others have done it. You can do it too. Take care, ladies and gents. Thank you all. And I look forward to seeing you all on the other side very soon. Take care. Lisa, I want to thank Lisa so much. Thank you, Lisa. You're amazing. You're consistent. You're always giving 100% to the trainees. It's such a pleasure working with you. I am lost for words when it comes to you. If any of you really want to be inspired, Lisa is there to guide you and to help you succeed as well. Thank you all and look forward to seeing you all soon. Take care. PreWayShortcuts.com. Join Pre-Way Shortcuts. Create yourself a free account on Pre-Way Shortcuts. I'll put that. Most of you don't know this, but you can create a free account on PreWayShortcuts.com. And when you create that free account, you get a lot of free information, revision information. You're going to access some videos. So go on to PreWayShortcuts.com, create yourself a free account, and then access a lot of free revision material. And I look forward to seeing all of you soon. Take care. Marvin, how can I join the Telegram group? I'm signed up on the course. So send an email. Send an email if you want to join the Telegram group. Send an email to info. Or just send it on the website. Go on the website and put a chat on there. Send it on the chat, and then we'll send you a link, a Telegram link for you to send your details to, and then you'll be added to the Telegram group. All the best, guys. Are there any more sessions before the exam? I'm going to see. I don't know. We still have other chapters that we can do, but I'm aware that time is really almost running out. So I don't know if I'm going to do a session. With Pre-Way Shortcuts private, I am still doing sessions with them, but I don't know if I'm going to do a YouTube session. If I'm going to do one, then just keep an eye. Just like today, I'm going to post it out. Most likely going to be more of like the weekend. or Friday. Okay, take care, everyone, and look forward to seeing all of you. Good luck. Believe in yourself. You can do this, and you will do this. See you all on the other side.